Many healthcare providers are struggling to keep up with their increased caseloads and manage their costs without compromising patients' healthcare levels. Best Home Healthcare Network meets these challenges head-on and assists in changing the way we look at healthcare today.
Many people don't want to stay at hospitals, whether it's due to the high risk of infections or the grand expenses. Rather than live in an assisted living facility, people tend to be more comfortable receiving care in their own homes. Since 2006, Best Home Healthcare Network has provided home healthcare services to patients in Chicago. In 2009, they became Medicare certified and accredited by the Community Health Accreditation Program.
We service patients that were in the hospital, just had surgery, or simply need help managing a chronic illness. Our healthcare professionals will help the patient recover and gain independence.
Best Home Healthcare Network provides skilled nurses and medical social workers whose goals are to improve patients' quality of life. From recommending certain diets, to suggesting certain exercises, to home safety risk assessments, the home healthcare staff considers every aspect of their patient's well-being.
When a patient transitions from hospital to home, our clinical team will educate the patient on when to utilize the ER and when it's appropriate to utilize the immediate care facility. When a patient transitions from hospital to home without our services, this patient, in a case of emergency, or not even in any case of emergency, will go back to the hospital ER. And when we're intervening, we will significantly reduce the cost of care and the cost of ER utilization for both the hospitals and the insurance companies.
Best Home Healthcare Network is the only home healthcare agency with Medication Therapeutic Management Advantage, which can help patients with significant savings on medications. Their MTM expertise allows the average patient to save as much as $400 to $1,200 a year. The MTM Advantage provides a high standard of care, develops a customized drug plan, and coaches patients to better understand their medications. Best Home Healthcare Network is the only home healthcare agency in Chicago that supplements home health services with a unique on-staff pharmacist who works with the doctor and develops a customized drug schedule that will help the patient.
We want our patients to get well in their home. We do this by educating them on the disease process and by helping them navigate through the healthcare system.
To provide quality comprehensive care, the Best Home Healthcare Network team includes skilled home occupational therapy, home physical therapy, and home speech therapy professionals. Their goal is to improve mobility and help patients feel stronger so they can enjoy life, become active, and be independent. The therapist will coordinate with the patient's doctor to develop, implement, manage, and evaluate a customized care plan. Best Home Health Network's therapists also communicate with their social workers and dietitians for 360-degree care. Their registered nurses and licensed practical nurses are on call 24/7, and their team is always available for support.
The reason why Best Home Healthcare Network continues to stay at the forefront of healthcare is because we'll watch where the industry is going. We'll listen to the voice of the patient very carefully, and based on the feedback, we'll develop innovative clinical and outcome-based care models that are beneficial to the insurance companies as well as the hospitals. And we'll put tender loving care at the forefront of our day-to-day interactions with patients.